This is the first video in a series where we will listen to Myles' claims about for-profit healthcare. Here we go.
Because all those countries have dual care. Pretty well, most Western European countries have.
Right.
And the reality is, if you compare Canada with all those jurisdictions, you find that, well, we all have universal healthcare systems. They have dual systems. There's different, they're structured somewhat differently in some of the places. They all have better metrics and outcomes than we do. And I'm talking not just Alberta, I'm talking Canada. And a lower cost per capita than we do. Canada has the second most expensive healthcare system in the world. The only one that's more expensive than us is the United States.
Mm-hmm.
Nobody thinks the United States is the system we want to follow. Nobody.
Okay, then why don't you vote for private healthcare in Alberta?
Well, that's what I said. Let's look at the European jurisdictions.
You just heard three very strong claims made back to back. One, that most Western European countries have dual healthcare. Two, that those systems have better outcomes. And three, that they do it at a lower cost than Canada. That sounds decisive. Like the debate's already settled, right? Okay, but it isn't. The first problem is the word dual. Because in countries like Denmark and Finland and Sweden, healthcare is still single payer at its core. Public systems dominate. Sure, private care exists, but it operates under very strict rules. Okay? In many of those countries, doctors are required to spend the majority of their working time in the public system. Private billing is capped, and private care cannot grow in ways that undermine public capacity. Okay? And the governments actively plan workforce numbers and hospital throughput. Okay? It doesn't happen incidentally. Okay? These rules exist because early versions of two-track care caused harm. So when you hear most countries have dual systems, what's being left out is the part that actually matters, the safeguards. Okay? Now let's talk about the outcomes and the cost. European countries don't get better results because people can pay to skip the line. They get better results because they regulate prices, they invest heavily in primary care, they control administrative costs, and they protect the public system from being drained. None of that is guaranteed by Alberta's legislator. Alberta's bills do not clearly define how much time doctors must spend in the public system, how private expansion will be capped, how workforce division will be prevented, or how public wait times will be protected if private pay increases. These aren't minor details. These are the entire question. Okay. And then finally, there's the cost argument. Okay. Sure, Canada spends more per capita than many European countries, but higher spending does not mean our system is too public. It means we have poor primary care access. We have fragmented delivery, we have staffing shortage, and expensive downstream care because the problems aren't caught early. Okay? European countries fix those issues inside the public system before adding private in. So when you hear this framing that Europe proves two-tier works and Canada has no choice, it's the only way to go, let's understand what's really happening. Okay? A very complex set of systems is being reduced to a simple story. Okay? They allowed private care, so we should too. It'll all be great. Okay? But without the rules that make those systems work, that comparison doesn't hold. Okay? And if this foundational claim falls apart, everything built on top of it does too. Okay? So if you don't want to see our healthcare system come crumbling to the ground the same way the attempt to privatize DynaLife Labs did, sign your recall. Let your government know you're not happy.